The college years and experience are the best years of your life. It's very prevalent in the youth and the younger demographics. So knowing your status and getting tested, not only for HIV, but also STIs, which are very common on college campuses, is of big importance.
I feel as though we look at HIV and AIDS as just something that, oh, I can never get, or something that will not be taken seriously when there's, oh, you know, there's other diseases out there that we can get, and HIV isn't the closest one that I can get. But people need to be more informed, and they don't have enough information to realize that.
I know a lot of people do sort of are a little bit hesitant to get tested, as Sergio knows, and there's lots of different reasons for that. Some of it it's just the stigma and the bias of HIV. Some people are afraid to find out. Some people still think it's a death sentence. And some people, you know that old saying, ignorance is bliss. Some people just feel like they're better off not knowing.
When you think of HIV and AIDS, it's such a controversial topic to talk about, and a lot of people are scared to talk about it. They're nervous because it's not something that people are comfortable talking about. But I think people need to just put that stigma away and be brave, because by getting tested, not only can you find out your results, make sure that you're healthy, and if you are tested positive for HIV, you can get help for that, and you can find counseling and talk to the right people, and it can really make a difference in your life.
Yeah, I was afraid to get tested.
I had that stigma of, oh, it's gonna scare me, they're gonna try to take blood or anything like that. It's honestly something so easily that you can go down there, it's just a cotton swab, they put it in your mouth and do it, and it's all set. It's really simple. I think students need to just know that.
AIDS Project Rhode Island developed the Get Tested, Take Charge, Get Tested program, which is what we have currently now. And since then, we have become the #1 testing provider on all college campuses in Rhode Island.
What happened in Rhode Island was they instituted a clean needle and needle exchange program that really has essentially almost wiped out HIV among injection drug users.
Parents or...
You have no idea.
Yeah, or just like a cut.
Oh, okay, let's say.
So I'm not really sure.
HIV is relatively hard to get. You need exposure of blood or semen or other sexual fluids within a mucous membrane to your eye or your mouth, or to direct contact with your blood. You can't get it from sharing towels. You can't get it from toilet seats, you can't get it from mosquito bites, you can't get it from kissing.
The youth today don't know a whole lot about HIV and AIDS. They look at it as it's possibly an older generation's disease. It's something that won't affect them in their daily lives or their daily routines. However, the youth is the most vulnerable population to contract HIV, as well as STIs. So it's really important that the youth make wise decisions, but know the facts. HIV does not discriminate against age, against race, against ethnicity, against cultural background, against economic background.
Not just gay people have HIV and AIDS, like it's everyone.
We see people across every walk of life, every sexual orientation, every background get infected with HIV. But with someone with HIV who's diagnosed with HIV and has a relatively stable immune system, on medications, their life expectancy is essentially normal with someone without HIV.
The AIDS Project Rhode Island's a great nonprofit that really does great work for the state and for people with HIV and AIDS, and everyone's really involved in getting the word out there on social media and to friends around campus to get tested on the testing dates.
Going in social media, going to the dining halls, going to the union and talking to people and getting them more informed, and then maybe info sessions and then testing dates, and just a combination of all those things can help.
By spreading awareness through college campuses and getting more people aware of getting tested for HIV, how to prevent HIV, I would hope that people would get more involved with this and try to make it more known throughout campuses.
So what we really need to do is have the entire medical community of Rhode Island test everyone once a year, And those are the recommendations in the United States, is that everyone should be tested regardless of risk factors.
The main goal, literally, it is in conjunction with the Public Health Department and the whole slogan, getting to zero, which it is to get to zero HIV infections in the state of Rhode Island.
It's something that needs to be discussed, especially in this day and age, especially on a college campus, because yes, students are having sex, whether you want to admit it or not, and students need to be, they need to be aware of how to take care of their body and how to be safe with their partner.
Knowing your status, just knowing your status, know their status. So it's really important that everybody knows their status, and knowing your status. To know their status, that's what know their status. Knowing your status, the important message is know your status. If every single student at URI came and got tested, that would make me happy.
You really do want to be more aggressively tested for some of the other STDs, so gonorrhea and chlamydia specifically, because they can increase your risk of getting HIV.
Enjoy a college experience. It's the best years of your life. It goes by like this, and thank you.
I tell my patients this, I think in our lifetime, I think in all of our lifetimes, that we will see a cure.
You can visit AIDS Project Rhode Island.org for more information about HIV and AIDS and getting tested. Or you can call 831-5522 extension 3824 to make an individual appointment.